On February 11th, your science advisory table predicted a disaster if the government eased restrictions. The government did indeed ease restrictions against the public advice of many public health care officials and scientists, and the disaster is here. But instead of paid sick days and safe workplaces, the Premier on Friday closed playgrounds and enhanced police powers. Public health officials were shocked and angry, and yet the government today keeps saying they are following the advice of scientists and public health officials. So, Speaker, will the Premier commit today to sharing the scientific data and public health data table advice that led to his decision to close playgrounds and institute carding instead of focusing on making workplaces safe and helping essential workers stay safe in the workplace?
Minister of Health to reply.
Thank you, Speaker, and thank you to the member for the question. And I can certainly advise that all of the information that was provided to us by the Science Advisory Table has been provided to you and provided to the people of Ontario. Dr. Brown has been very outstanding in providing public health measures, the advice of the Science Advisory Table, what is happening across Ontario, and what we've seen in the last month or so is an incredible rise in the number of cases due to the variants of concern. We anticipated that based on what they told us, and we have been building up our hospital capacity, building up our health human resources, trying to build up our vaccine supply, and we are working with the federal government, but several of the shipments have been delayed. Notwithstanding that, we are working very hard to get as many needles into as many arms as possible in order to stop the transmission and protect the people of Ontario.
The supplementary question.
Speaker, I ask that question because public trust is vital to combating this pandemic. And how can we build public trust when so many public health officials, doctors, nurses, and scientists and other experts are essentially saying that the government is not following their advice? My gosh, even one of their own caucus members, a member from Scarborough Centre, put out a letter asking for the data. Their own caucus member. So, Speaker, how can we expect the public to be on our side if we're not going to be open and honest with them? Dr. Uni talked about Friday being the darkest day of his career. And so, Speaker, I'm actually through you pleading, will the government please release the data, be transparent, have the information accessible to the people of Ontario so we can indeed all be together and have the information we need to make the right public health decisions in the province?
Minister of Health.
Thank you, Speaker. The concern you're expressing, I would say to the honourable member, but this information has been released. This information is released by Dr. Brown on a regular basis. I know that Dr. Uni works with him, Dr. Sander works with him. There's a number of public health technologists trying to give us an indication of where we are going with this, which has been exacerbated times 10 by the variants of concern. We knew this was coming. That's why we've been taking steps in order to deal with it, both in terms of blunting transmission, but also by building hospital capacity. We are working on both of those aspects right now to make sure that we can take care of the people who are coming into the hospital with COVID-19 and to do whatever we can to blunt that transmission because it's happening in the community. Now, with respect to the playgrounds, we heard what people said. We understand from many that it's very important for children to be able to get out to get some physical exercise. It's good for their physical and mental health. We understand that. But we are still asking people to please continue to follow those public health measures